Start in a deep squat position with your arms draped over your partner for support. You can add pillows under your hips for extra support to help you relax. Your partner can help you by massaging your shoulders or your back, again, just to help you relax. Additionally, your partner can put their arms under your shoulders and gently lean back to add a little bit of lift and traction in the torso to help the baby continue to descend. Make sure to relax and continue to breathe in this position. For the lap squat position, sit on your partner's lap. You can lean forward on their shoulder for extra support. From here, your partner can add some gentle counter pressure, pushing down towards your sacrum. They can also perform some hip squeezes or gently rub and massage your back. This is really helpful if you're having a lot of back pain and back labor. This is another form of the supported deep squat. Cross your arms and grab your partner at their forearms as you move into a deep squat position. From here, you can focus on breathing, or you can add the gentle hip sways side to side. In standing, have your partner place their hands under your belly and add a gentle lift upward as you lean back against them. You can add gentle hip sways, trying to focus on relaxation as we open the mid-pelvis and help encourage the baby to continue to descend. Another form of supported standing is the forward lean on your partner. From here, you can breathe or add gentle sways to help open up the mid-pelvis. Your partner can just support you, or they can add the back rubs or downward sacral pressure if you're having a lot of back pain and back labor. While leaning forward on an elevated surface or a ball, your partner can add a gentle downward pressure with their hands towards your sacrum and tailbone as you sway your hips side to side, focusing on breathing and relaxation. They can also perform gentle massage along your back for comfort. Again, this is helpful for that low back pain and back labor. This can be performed with or without a step. If a step or several books stacked on top of each other are available, place your foot on that and gently shift your weight side to side as you lean forward on your partner. They can add gentle back rubs or back massage. Perform on both sides to open up the mid-pelvis. Another option to perform the lateral leans is in a half kneeling position over a ball. Again, your partner can add that downward sacral pressure. They can also perform hip squeezes at the pelvis or help the pelvis rock side to side to encourage the mid-pelvis to open up and encourage the baby to continue to descend. Perform this one on both sides. This can be performed in a hands and knees position or while leaning over a ball. Make sure your knees are open wider than your feet as you rock backwards to open up the pelvic inlet. This is a great place for your partner to add the hip squeeze where they're gently squeezing your pelvis together as you move. If this becomes fatiguing for your partner, instead of using their hands, they can stand up and squeeze your pelvis with their knees. As they do this, you can continue to breathe, rock, or they can add the back massage or downward sacral pressure. To open up the pelvic outlet, you're going to be in a similar position, except your feet are now wider than your knees as you are in a hands and knees position or you're leaning over a ball. Add an extra anterior pelvic tilt to get the coccyx out of the way. And again, gently rock forward and backwards, or simply stay in the position and breathe as your partner helps support you with the hip squeeze, back rubs, whatever feels comfortable. While seated on a birth ball, your partner can stand behind you and massage your shoulders as you gently rock your pelvis forward and backwards, side to side. Perform the pelvic circles, the pelvic figure eights, all to open up the mid-pelvis. Or you can simply just focus on the breathing and relaxation. If sitting upright becomes exhausting or if a big contraction comes, you can gently lean forward on your partner. Again, as you continue to sway side to side, or in this position, they can help massage your back, perform the sacral, downward pressure, whatever feels more comfortable for your body. This next series of movements shows how to support your partner with a sheet or a scarf. Wrap the flat end of a sheet around your partner's belly and add a gentle upward lift as they perform their rock backs or their lateral sways. The gentle upward lift on your partner's belly helps to assist them in their movements as well as take some pressure off of their low back. If a big contraction comes and your partner stops moving, you can continue to support them by focusing on rotating the belly and the pelvis side to side to help encourage the pelvis to continue to open and the baby to descend. You can also move the sheet down towards your partner's pelvis just below the belly and add a gentle traction force backwards while they're in a puppy pose, focusing on posterior expansion and breathing through their contractions. Another option is to lie on your back with your knees bent. The sheet is going to be focused along the back of your pelvis and low back. Your partner is going to lean backwards to add a gentle traction force, which is going to give you a nice stretch along your low back. In a side lying position, you can have your partner support your leg and rock your pelvis forward and backwards. If we are towards the end of labor and we're trying to open up the pelvic outlet, we want your foot just above your knee. This is a great position if you had a really good epidural and you're having trouble moving on your own. This can also be performed with the ball or peanut supporting your leg instead of your partner. Your partner can then focus on just rocking your pelvis forward and backwards, or they can go back to performing any of the back massages or supporting you in any way needed. Remember to change positions every 20 to 30 minutes and continue to move through labor and delivery.